I'm Anne Wales. I'm the Programme Lead for Knowledge and Decision Support in the Digital Health and Care Innovation Centre, and I've been working with the Scottish Library and Information Council and the Alliance for quite some time now to develop and implement the Collective Force Action Plan. I'm going to stop sharing for a few minutes now and just hand over to Lindsey Henderson, who's the Head of Programmes in the Scottish Library and Information Council. And Lindsey is just going to formally open today's meeting. So thank you, Lindsey.
Thanks, Anne, and good morning, everybody, and welcome. We're so glad to see so many faces this morning. I was going to start off by doing housekeeping, so I'm delighted that Anne has covered all of that for me already. And just to reiterate Anne's comments about the chat, we're going to save the chat at the end of the meeting today, so if you've got any thoughts, comments, suggestions, feedback, please put it in the chat, because we'll have a record at the end, and it'll be great to collect all your feedback in one place over the course of the morning. Anne has also introduced me, so that's great. I was going to tell you who I am, but no need, that is gone. And in the true spirit of a collective force, this is a jointly organisation, and it's thanks to Anne and Janet Crozier from DHI and Sarah Redmond from the Alliance that we're coming together for such an excellent programme this morning. So thank you for all the work that's gone into pulling this together. The publication of Health on the Shelf and a collective force for health and wellbeing, which Anne's already mentioned, back in 2019, pre-pandemic, who would have thought it, has been such a game changer for public libraries. The role that libraries play in supporting better health outcomes for communities has now been recognised in healthcare policy. And Chief Medical Officer Gregor Smith, who I'm sure a lot of us have seen a lot of over the last few years, which we might have not done usually, is publicly supporting the role that libraries play in health, especially the role that they play in realistic medicine. So it's been really great to receive that support and that recognition. Just a recent update on the kind of pathway of a collective force. 10 libraries have recently been selected as near me points supporting digital healthcare appointments in the community. That's about to roll out soon, and that's been a really exciting development, and I'm sure the partners are really excited to get started on the next part of the journey for community health. The publication of a collective force action plan refresh last year is also supporting libraries to make huge strides. And this morning presents an opportunity to begin to scope Pathfinder projects with a number of important partners who are interested in working more closely with library services to help take a collective force action plan forward. So this morning we're delighted to welcome Diabetes Scotland, Alzheimer Scotland, Social Work Scotland, Scottish Care, Community Link workers, Reading for Wellbeing services in school libraries and NHS libraries. The partners are all geared up to give you lightning presentations to give you more information about who they are and what sessions you might want to join this morning. So I won't elaborate on who anyone is. I'll let them do their own thing to tell you more about themselves. This morning marks the start of the journey, and the knowledge that you all have in the needs of your community is going to be absolutely invaluable in taking this forward. So I really hope you enjoy the session. There's some excellent speakers and some excellent connections to be made. I really look forward to hearing all the ideas that come out of this session and your feedback. And for now, I'm going to pass back to Anne, who is going to give you a bit more detail about the criteria for Pathfinder projects.
Lovely. Thank you so much, Lindsey. I don't know if anyone noticed, but I had a momentary loss of connectivity there. So I hope that doesn't happen again while I am going through the introduction. Just to be on the safe side, perhaps I could ask people to turn off their videos, and I'll do likewise, as there are quite a lot of us on the call today. So I'm just going to share my screen again and take you through a quick introduction to the purpose of today's meeting. So just to take us all back to the overall aim of the Collective Force for Health and Wellbeing Action Plan, its aim is to establish libraries as essential partners in health and well-being in their communities, not just as sort of nice to have, addition or option to support people, but really essential partners with an active and important role in delivering these key strategic goals for health and well-being that are embedded in national policy. Independent living, self-management, support across the whole of life from birth to death, and care and support in the right place at the right time, that local support that's really so essential to continuous health and well-being. Healthcare strategy commits to achieving those health and well-being goals by empowering people and communities to self-manage and be active partners in decisions about their health and well-being, through partnership across community services, third sector and health and social care services, and by exploiting the full potential of digital technology. And I'm sure it's abundantly clear to everyone in this call that libraries have a key role to play in all of the areas here that are so essential to overall healthcare strategy just now. The criteria for the Pathfinder projects we're going to discuss today are that they should help to deliver that overall aim of libraries as partners in health and well-being, and should do so by delivering the vision of collective force, which is laying foundations for a cross-sectoral national network of libraries. And by cross-sectoral, I just want to stress that means libraries across local authorities, health and education coming together to jointly make libraries a go-to place in their communities for four things: trusted health and well-being information, which may be in digital form, but also in other forms; for digital information and health literacy skills development; for bibliotherapy, for personal growth and therapeutic support; and fourthly, for the interpersonal human interaction and empathy that is so essential to everybody's health and well-being. So your Pathfinder projects that you begin to scope out today should meet at least one of these four criteria and contribute to this vision of the cross-sectoral national network. It's also essential, as it's set out in Collective Force, that Pathfinders should really be designed to meet identified evidence-based needs within your community. So they should be co-designed with citizens and communities. A really key strand within Collective Force is to strengthen the really vital role and quite unique role that libraries can play in reaching out to groups that are at particular risk of health inequalities. For example, due to age, belonging to ethnic minority groups, sensory impairment, physical or learning disability, or socioeconomic deprivation. We know that all of these factors have a significant impact on people's health and well-being outcomes, and we know that they've also had a disproportionate impact during the COVID pandemic for these particular groups. So we really want our Pathfinders to develop that role of libraries in improving health equality across the system. And the third criterion, just reiterated here, really is the importance of Pathfinders being collaborative initiatives, so working together with libraries in other sectors and also with health and social care and third sector partners. The Pathfinders are expected and really wanted to be seeds that will grow over time. We're not expecting libraries to come up suddenly overnight with massive projects that will instantly transform health and well-being across the country. All our experience so far has shown that developing the role that libraries can play is a matter of nurturing growth So starting small, it's absolutely fine if we just have 1 or 2 small Pathfinders in each of the areas that's put forward today, testing the impact of those small Pathfinders and gradually growing and spreading over the next few years. One of the reasons it's so important to nurture that growth is because these Pathfinders are dependent on building relationships with partners and new kinds of relationships with the library users. And that takes time and cultivation. As everyone I'm sure has experienced, relationships take a while to negotiate and to build true trust on all sides. And we also really want to make real that principle of collaboration and working as a network by providing plenty of opportunities for everyone involved in Pathfinders to support and learn from each other so that we grow truly as a network that is that collective force. So I hope that just gives you a little lead in to what we would like you to be thinking about as you scope out your Pathfinders. Now going to hand over to the partners that have very kindly come forward to express an interest in the opportunity for collaborating with libraries on Pathfinder projects. So we have 4 minutes from each of 6 partners. I'm going to try and keep to time. So please forgive me if I do interrupt and just ask you to wind up. We're going to start by hearing from Alison Grant, the Engagement Manager in Diabetes Scotland. So Alison, are you okay to unmute? And if you just let me know when you'd like me to move the slides on.
Next slide. Thank you, Anne. So Diabetes Scotland is part of Diabetes UK. We're working to create a world where diabetes does no harm. We raise awareness of the condition, we influence and campaign to improve care, and we provide help, support and information for people living with diabetes and their families and carers. We also provide support, information and training for healthcare professionals and others working in health and social care. Our website is packed with information about diabetes, including interactive resources. In Scotland, there are currently over 317,000 people living with diabetes, and that number is growing. It's an increase of 5,000 on the previous year. Diabetes rates have doubled in the last 20 years. A large part of this is due to the growing rates of type 2 diabetes. It's estimated that over half of type 2 cases could be prevented, delayed, or put into remission. Diabetes is 80% higher in the most deprived areas, and people living with diabetes are twice as likely to develop complications when living in poverty. Diabetes is a relentless condition. People living with it have to make an average of 180 extra health-related decisions per day. On average, they spend 2 to 3 hours per year with a healthcare professional. The other 8,757 hours are spent self-managing. Next slide, please. By working together, we can increase opportunities for people to better self-manage their condition. By making access to the clinically approved resources, such as those listed on the slide, available through libraries. We're very aware that not everybody has digital access at home, and we've been working on a small project in the Highlands, partnering with NHS Highland Library Service, AbilityNet, to make tablets available to those newly diagnosed with type 2 or at risk of type 2 through the library service, and they would be enabled to access the trusted resources I've mentioned in the slide, and also access to NHS education and appointments. We're also a named partner in a funding bid by Glasgow Life, a project based in libraries based on the Macmillan model. We also have a volunteer base that can be mobilised to provide support if needed. We provide peer support training programme, trained peer support facilitators, and a number of different digital and peer support groups. All of these could be accessed through digital devices available in libraries. Next slide, please. So currently 1 in 14 people in the UK lives with diabetes. So most people coming into a library will have a connection to someone living with the condition. Libraries are a trusted source of creditable information. Our resources are clinically approved. And I believe that by collaborating, what we are proposing supports the aims and addresses inequalities by improved access to health and wellbeing information and support, such as that described in previous slides. This access could strengthen digital information and health literacy in the community. There would also be opportunities to address isolation by accessing our digital peer support or local face-to-face groups. By working together, we can tackle inequality by increasing opportunities for people to access digital support, which would hopefully improve their self-management and lead to improved health. Thank you.
Thank you very much indeed. That was great, Alison. And it was fascinating to hear some of the statistics you gave there. Move on now to Caroline Miller from Alzheimer Scotland. So Caroline, if you'd like to come off mute, is that
Hi
okay?
There. Yes, please, yes, and feel free to move on to the first slide, thank you. So yes, so Alzheimer Scotland is Scotland's leading dementia charity, and the aim of our charity is to make sure that nobody faces dementia alone. We do this through our 3 different strands of 3 different programmes: prevention of dementia, caring for people who are living with a diagnosis of dementia, and striving to find a cure for dementia. There's many, many different types of dementia, and the sad fact is that around 90,000 people are living in Scotland currently with a diagnosis of dementia. We estimate that that figure is going to rise dramatically due to diagnosis rates obviously taking a bit of a hit during the pandemic. 1 in 3 of us will go on to develop dementia, unfortunately, in our lifetime. But the positive news is that actually 40% of dementia is actually preventable. And I think that's why this particular opportunity is so exciting, because I think that's one of the biggest areas that we could potentially make an impact with this project. Next slide, please. So there's lots and lots of different ideas that we've had for potential to collaborate, and I realised that we may need to kind of try and hone this down a little bit. But I was particularly interested listening to the previous presentation, because I think there are so many parallels with diabetes, because diabetes is one of the conditions, along with heart disease, that can really increase your likelihood of going on to develop dementia. And we're doing quite a lot of work around this space at the moment of through our Brain Health Scotland programme on dementia prevention. So what we're thinking about with the library project is the potential to host. We've developed a quiz, which is a diagnostic tool that helps people to look at their own personal risk of developing dementia, and gives them tips on things that they could do to try and reverse those risks. An ideal opportunity for us would be hosting these within libraries in information points on tablets. We also have an app we've developed, which is called Purple Alert, which is being developed with Police Scotland, and that helps find people with dementia when they go missing. And again, we need that critical mass of people to help us. More people that sign up to Purple Alert, the more chance we have of finding people that go missing, and that really does take place at the heart of the community. The more people in a community, the better, who have the app on their phones. So again, signposting that promotion of that in libraries would be fantastic. We also have developed a virtual resource centre, which gives people access to services that we can provide, and helps people and carers find out more information about dementia. And again, I can see the library being a fantastic point for that, and that would also help people learning the tech skills as well. Kind of onto the kind of care side of things. One of the initiatives you're talking about is around the social interaction. And we host in our dementia resource centres, we host dementia cafes. We would love to bring activities like that out into the community, get our dementia advisors into the community, into libraries to talk to members of the public, host our coffee morning tea and blether sessions in the libraries, and just bringing that support right out into the community. The other program we've developed during the pandemic is an Action on Rights team, who are responding to some of the kind of access challenges that we've been having, and seeing people that we support been telling us about during the pandemic. And again, that would be another option for clinics to be held in libraries across Scotland as well. We run therapeutic
Caroline,
groups. Am I running out of time?
Okay,
right.
Thank you.
No worries. Do you want me to just stop, or?
No, if you just finish up, if you make your last point.
So just if you just hit on to the next slide, then we've probably put far too many things in. So it's all around, I think most of the initiatives that I've talked about really will address most of the issues that we're talking about, addressing isolation, offering some therapeutic practice, helping people to stay healthy and prevent dementia, and focusing on kind of self-managing conditions as well by taking control of their health. Thank you.
Thank you so much. I like the way that you'd broken down the different opportunities into the self-management and the caring interpersonal aspects. And I like the final suggestion around cookery classes and so on as well. That is such a wealth of opportunity. I'm going to now turn to Roseann Logan from the Alliance, who is the Assistant Director for Community Links Workers. So Roseann, hopefully you're still there.
Yes, thanks very much, Anne. Hi everyone, my name's Roseann, and I'm involved with the Links Worker programme, which is a programme that brings together the world of primary care and community development. If we move to the next slide, please, Anne. So our programme initially started in Glasgow in 2014 within 7 GP practices that were based in deep end areas, which are areas of high socioeconomic deprivation. Where we are now within Glasgow, we're based in 53 GP practices now with 51 links workers. And last year we set up our programme in West Dunbartonshire, where we will cover the whole of West Dunbartonshire. There's 16 GP practices based there, and we will have a links worker. We'll have full-time equivalent 10 links workers based across those practices. The links worker programme, as I said, individual workers are employed by the Alliance, but they're hosted by the GP practice, so they're really embedded within that practice. They work with the whole practice population. And you may have heard the term social prescribing. So it's around that opportunity to work with individuals who come to their GP with social issues, but they feel that they've nowhere else to go. That position of trust is with the GP practice. So the links workers will work with patients cradle to grave, anyone on the patient list. They'll carry out one-to-one support with that individual. They have hour-long appointments, which for many people that has been the most important part, that they feel they're given that time to talk and to discuss any issues that they have. There's no referral criteria, so it can be for any condition, any issue that people have, and we'll find that people will be referred for things like bereavement, benefits issues, housing, new diagnosis, social isolation, loneliness. So any issue, individuals can be referred, and the links workers will work with those individuals. Next slide, please. So some of the suggestions that we have for the programme is our practices are based in clusters, and it will be no surprise that there's, opportunities to be working with the libraries, because we're in Drumchapel, Postle Park, Springburn, Easterhouse, Govan, Pollock, Ibrox, areas where libraries are also there. So taking that cluster approach and the links workers working then closely with the library teams and doing a form of outreach service. And we've actually started to scope this in one of the libraries in Glasgow, where one of the links workers unfortunately doesn't get a lot of space in their GP practice, and especially with COVID, spaces became even more of an issue. So the links worker is going to look at carrying out an outreach service in the library and be there an afternoon once a week, and we'll work with individuals coming through. We'll also get that chance to work closely with the library staff team, because that's really important, and it's been mentioned already, relationships, really, really important. Accessible spaces as well. It's good that the libraries are, in the communities where the GP practices are, and it's good that we get that opportunity to work closely together. I'm just mindful of time. Digital health and champions, we, during the lockdown, worked with Connecting Scotland. We're able to start supporting individuals who wouldn't have access to iPhones, iPads, wouldn't have the opportunity or funding to be able to have Wi-Fi in their homes. So through Connecting Scotland, we were able to enable individuals, and a lot of our team became digital champions. If we move on, Anne, I'll quickly go through the last slide. And just, we take a whole system approach. So we'll look at unmet need, we'll look at how we can capture and work with individuals, and it's that social and community networks. Libraries are well placed, as I said. In the last year, we had just under 7,000 referrals across our Glasgow team. We had just under 30,000 appointments with individuals. We'll be creative of where we meet individuals, and working with our libraries and our library colleagues will be really vital for our programme, but also to continue working closely with the library programmes as well. Thank you.
That's wonderful. Thank you very much, Roseann. And while your programmes are based in Glasgow and Western Bartonshire, I would just highlight that there are similar community links worker roles in other areas. They're sometimes called community connectors or other titles, but even if you're not in Glasgow or Western Bartonshire, it's well worth considering linking up with the other community link workers in your area. So we're now going to hear from Calum and Donna from Social Work Scotland, and they have a whole range of ideas for us centred largely on self-directed support. So I don't know which of you is going to speak first.
I'll go first. Good morning, everyone. Thank you, Anne. I'm Calum, Campbell, and I'm joined by my colleague Donna Murray. We're self-directed support project officers within Social Work Scotland. We're very happy to be here. Anne, can I have you go to the next slide, please? Thank you. So Social Work Scotland is the leadership body for social work and social care professionals. We host a network of the chief social work officers and support them along with other standing committees and subgroups. The self-directed support team ourselves have been around for 2 years, and we were funded by Scottish Government. And in that time, we've led the co-production of a framework of standards for self-directed support to help reduce the implementation gap and hopefully achieve better outcomes for people. Sorry, I keep talking about self-directed support. For those that don't know, self-directed support is the method by which social care is delivered within Scotland. It's the choice and control that supported people have when they're getting support. And research has shown that it's not achieving what it should be nearly 10 years later. So within the project, we have our framework of standards to improve that gap. And we also have our community of practice, which is a practice-based solution-focused forum for all 32 local authorities to share learning. We have our national collaboration, which was formerly our steering group, and that's about engaging with leaders and key SDS partners to steer project activities and really provide expertise into the emerging National Care Service agenda. And we have our focused implementation, and that is where we are currently testing out our SDS standards, namely our standard around worker autonomy, which is allowing social work practitioners to be autonomous. Donna will tell you a bit more about that. And we're currently testing that out in Edinburgh, Murray and Shetland. And I'll just pass to Donna to do the next couple of slides.
Thanks, Calum. Morning, everybody. So some of our suggestions is that this work would help with the implementation of the self-directed support standards. The standards describe what good care and support looks like for people, and it's supported by government and local authorities. And 2 of the standards are key in terms of independent support around information and that early help and prevention agenda. So we thought that some of our ideas would assist social workers who are extremely busy, working at that critical level, that they have a duty to carry out. One of the duties is around information and support about what types of support is available in communities. And that would include signposting, giving out impartial information, peer support, support to find out where advocacy is, and support to look at what your care might look like. We're particularly interested in connections with local community hubs, because that's the universal offer of people, particularly those who are not meeting that eligibility criteria for support. It's almost an alternative front door to services, and often means that people don't actually need a statutory service once they've had that early information and support. We also thought that it would be useful to, interest people in understanding that they have a right about how they're cared for and supported, and what that might look like in terms of access to community facilities. And also the promotion of our self-directed support library, which is a national library full of really good resources which help workers and communities know about self-directed support, including how to have a good conversation and how you might employ your own personal assistant. Final slide, please, Anne. We think that some of our ideas are particularly focusing on addressing that access to health and wellbeing information, and that's backed up by disabled people's experience in a report, My Support, My Choice, which interviewed 600 people who experienced self-directed support. And one of the key recommendations from that report was that people need access to a range of accessible and tailored information at different points of their journey. From finding out about assessments to what they need in assessment to actually what support might look like. And obviously extra work needed in terms of making that information to people that are much harder to reach, in particular minority ethnic communities, women and people who live with experience of homelessness, and younger people. So we feel that those connections might help if we can kind of use the libraries and help our social workers. Thanks, Anne, that's great.
Thank you very much. And I think the example you gave of meeting unmet need, where people aren't eligible for formal social care support, the opportunity there for libraries to help with access to information and community services is a really valuable role that libraries could play. We'll move on now to Scottish Care and Arlene Bunton, who has some ideas about opportunities for libraries working with care homes and care at home services. Thank you, Arlene.
Thank you, Anne. Good morning, everybody. As Anne had said there, my name's Arlene Bunton, Independent Sector Lead for East Ayrshire. We have independent sector leads across Scotland, and we all have our own locality that we are responsible for. If any of the partners that are interested here in building any collaborations, then I can certainly pass on the details for who's available in your area. Next slide, please, Anne. So Scottish Care is a voice for independent care providers in Scotland, the workforce and persons who access the social care services in Scotland. Basically, we're a representative. We are membership based, so we have people that can subscribe to us, have services that are provided directly by Scottish Care. Although some of the independent sector leads, such as myself, support the whole of the independent sector, not just the members. So I'm employed by the Health and Social Care Partnership, but my post is hosted by Scottish Care. So I'm responsible for all of the independent sector lead in East Ayrshire. We represent 400 organisations, which are about 900 different individual services, and we work across different sectors with the Scottish Government, Scottish Excel and COSLA, and accessing the right supports, respect and remuneration for people that are working within social care. The sector provides 88% of all care home places in Scotland, and over 55% of the hours are provided by the independent sector providers. As an organisation, we are partnership builders. We engage in lobbying, negotiating and leading the development of quality care services. Next slide, please. So I was really very keen on this project as soon as I'd been kind of sent the information on it. I come from a care home background as a senior in there, and we certainly used a lot of resources from the library within our setting. So in terms of how I think that we can have this partnership, we'd like to support people to live well on their own terms. so that they can attend events which suit them, socialise if and when they want to at a local hub where there's always going to be people there, and they can use reading as a therapeutic activity. It allows people to take control over their own health and well-being. So my proposal is that tailored packages could be made for individuals, as in kind of monthly packages of books, audio and information, kind of based on the interests of that person, so that people that are maybe in the care homes or at home that are not able to access the building itself can still take part in activities. It would be useful for people to be able to access current information on their own health based on multiple formats, so if they were needing things in larger print, etc., or again on audio, that they'd be able to do that. We'd like to be able to work as partners with health across with the health and care professionals, so attending drop-in sessions for things like smoking cessation, advice and bereavement, mostly be looking towards our care at home sector. However, we do have interest from several people within one of the care homes that I support who's actually looking to attend some bereavement classes, which I hope would be something that the library could facilitate. I was thinking maybe along the lines of a weekly wander from the hub where people can get some exercise, and again just for stimulation to help people overcome the barriers to improving their own health and promote self-management, take responsibility for their own health, and to free access to health information. Next slide, please. This is just a wee example form that I put together. I haven't collaborated with our providers for this, just because this is just kind of an idea at the moment. So the idea would be that the care home providers and the care at home providers and housing support providers would have a form similar to this. They would have access to the email address of the local library, who would be the lead person. They'd be able to take this to the individuals and say, get all their information off them. What are your interests? What is it that you're looking for across your health and well-being? And are you interested in coming to groups? That way that could be scanned and emailed back to them, and the conversation can start between the library and either the organisation or the individual if they're happy to be contacted. I've already got a few care homes that are quite keen on building a partnership and as I said, in this, and I've got meetings this afternoon from with the care at home providers where I'm going to kind of pitch this idea to them. So I hope that it's something that we're able to put together, because I do see a massive use for this project.
Thank you so much, Arlene. And finally, we've got Moira. If you could move on, from Breeze High School, who's going to talk about an exemplar project that others could potentially adapt in their and transfer to their area, focused on bibliotherapy. So thank you, Moira.
Hi, thank you very much. Well, yes, I'm Moira Paton. I'm the school librarian at Breeze High School in Falkirk Council. Next slide, please. It's impossible not to sound like Chris Whitty, but never mind. So the project that I've been working on is bibliotherapy story cafes. And the basic idea is using books and stories to encourage participants, in my case, school students, but also potentially teachers as well, but to encourage participants to feel better and to stimulate positive mental health and emotional well-being. The sessions are really simple and straightforward. During a session, my participants watch or listen to a story or an extract chosen by me, and then they have an opportunity to discuss their emotional response to the text. So thoughts, feelings, memories, etc. Anything that's inspired by what they've just heard. I love it because it positions reading as supporting positive mental health, and the library is a safe space of no judgment. It's a flexible approach that really suits school life, but real life as well. We're not expecting anyone to prepare. We don't give out homework. We can have a different group every week. It's not reliant on the same group of people participating every week. We do establish ground rules. It's really important that people feel safe, so we can't have offensive language, for example. But we also strongly let people know that there's no pressure to speak if you don't want to. Listening is enough. And we also make sure that participants feel that all the things that they say are valid and relevant. As I say, it's a safe space. Now, I was trained in bibliotherapy story cafes from Jen Horan, who's a librarian in Hamilton now. And I first learned about this when I worked in Edinburgh, and it was one part of our huge bibliotherapy project, which is run across all school libraries in Edinburgh. There's lots of information. My advice would be to, first of all, look on their Twitter account, and I've got a link to this here to find out the depth and scale of the project there. Okay, next slide, please. So the impact has been really strong. I've been in Falkirk since September. It's one of the first things that I wanted to run in Falkirk, because I've been running bibliotherapies, story cafes in Edinburgh for a few years before this. I find that participants connect with this and they respond to it really positively and enthusiastically. It certainly increases confidence. I'm watching my participants, more openly talk about their situations in ways they haven't before, and I watch them make new friends as well. I have run these cafes, story cafes, face-to-face and online over lockdown. We run them weekly on Teams, and they are equally successful in both formats. I love the fact that these sessions allow better recognition of my expertise to offer relatable texts, and also my expertise to be mindful of my needs of my participants, triggers and spoilers within the text and so on. I think as well, it's the only place in school where my young people can behave in such a way, and they really recognise and value this opportunity to bond with their peers through this experience of sharing their emotional responses. I think participants also see the sessions as being relevant and targeted to them, because I can adapt each session to meet the specific needs of the people in front of me. For example, some groups like me posing questions that might encourage an empathetic response, but some don't and prefer to be freeform, and I can tailor and adapt. Next slide, please.
If you could just be winding up
Yep.
quite quickly now. Thank you,
Will
Moira.
do. I'm on my last slide. So the transferable aspects is it introduces, explores trigger warnings. I think it also validates the importance of my participants' links between their lived experience and the text that they're reading. It encourages empathy, empowerment and resilience. It gives the students the words they need to construct their narrative of their lives. It's suitable for all ages, all abilities, and this can be run anywhere, not necessarily libraries, because of course you can take the librarian anywhere. It doesn't need to be in school. I'm done.
Thank you so much, Moira. That sounds an absolutely wonderful service that you're offering, and I'm sure lots of people will be interested in learning from it and following through in their areas.